My name is Dr. Ogbuanu. I'm the principal investigator and the site director for the CHAMPS Sierra Leone project. So thinking over my time in CHAMPS, something that I'm most proud of is really how our data has been used by the government, sometimes independent of our efforts. So over the past 5 years, I have seen the government take ownership of our findings and use them for policy and action. A specific example is the Vice President's office has a scaling up nutrition secretariat where they had connected with us to find the causes of death around malnutrition. This resulted in using CHAMPS data to lobby at the parliament for investments on purchasing malnutrition products for children in Sierra Leone. This became the first time the government has ever procured malnutrition foods, supplements for kids in Sierra Leone. So that would be one of the most proud moments for me over the past 5 years. The second would be the fact that we had done some analysis on our data and found in adults that malaria was not an important cause of disease and death. However, HIV was. So in a low prevalence setting like Sierra Leone, we found that more than 20% of the deaths of adults are being caused by HIV. This was a major surprise finding. It led us to begin to present this data to so many other players in the field, the likes of UNAIDS, WHO, CDC, and it resulted just last year in $8 million of funding that has now come to Sierra Leone to better understand the HIV epidemic in Sierra Leone. So in terms of what has surprised me over the past 5 years I've been working in CHAMPS, I think for me a major surprise has been that we are finding that more than 50% of the causes of death are linked to systemic barriers to care. This includes access, but I think more importantly, quality of care. So women and children in Sierra Leone are supposed to have free health services, but in reality, on the ground, access is a challenge because there's still a financial burden to access. But also second, the quality of care. So we have seen that both the nurses, the midwives, and the doctors who take care of children and women in our setting in Sierra Leone are completely undercapacitated. So we see that if they were to follow the standard operating procedures, if they were to do the right things for the patient, even with the limitations in resources, these kids would have lived. So that surprise has led me to begin to invest more and more in training, in mentoring, in capacity building, in one-to-one opportunities for hand-holding and in supportive supervision. We are now working very closely with training institutions and certainly with the government and other partners to help improve the capacity of our staff. Because again, as we go through the decode meetings, you find that so many wrong things were done along the way that may have resulted in this child dying. And had those things been done correctly, they would not have died. So looking ahead to the next phase of CHAMPS in terms of what we can achieve, I'm really big on the so what. I believe we need to continue to leverage our comparative advantage in terms of leading cutting-edge science, in terms of causes of death, but we need to make a strategic shift to begin to invest more in the so what. For me, so what really has to do with implementation science as well as with policy change. So I would hope that CHAMPS begins to use our data to influence policy in the countries where we work at the regional level, but also at the international level. There are many questions that are not being answered at the country level, but that CHAMPS has information to answer. Rather than wait for those data to be published, I would hope that in the next 5 years I will begin to engage more strategically with governments, with policymakers, and certainly with implementers to understand what needs to change in order to improve mortality for both children and potentially for adults.